Kitty. My name is Christasia. I'm a student with the College of Central Florida. How are you feeling today? Well, that's good. Okay. Well, today I'm just came in here today just to do a physical assessment on you, but it's going to be more focused towards like a cardiac assessment. Do you have any questions before we get started today? Okay. All right. Well, let me go and wash my hands and I'll be right back with you. Okay, I went and washed my hands. Before we get started, could you tell me your name and date of birth? Okay, your name is Miss Kitty, and your birthday was March 18, 1980. All right, perfect. Okay, so a cardiac assessment is basically me just using my stethoscope, and I'm also going to be checking for extra things. I'm going to be listening for maybe extra heart sounds and just seeing if there's any vibrations or pulsations. And also I'm going to be checking your neck for jugular vein distension, okay? But first we're going to start off with me listening to your heart, okay? But before we do that, let me palpate and make sure there is no vibrations going on or any pulsations. If you have any pain anywhere, just let me know. Okay. And now I'm going to go ahead and use my stethoscope. Okay, and I'm going to start listening to your aortic, which is the second intercostal space on the right side, and then your pulmonic, which is your second intercostal space on the left side, and then I'm going to go down to your Erb's point, which is your third spacing, and then I'm going to go down to your tricuspid valve, which is your fourth space, and then your mitral valve, which is your fifth intercostal midclavicular line. Okay, and then I'm going to go ahead and I'm going to use the bell of my stethoscope, and I'm going to go ahead and take a listen again. So starting with the aortic, then the pulmonic, Erb's point, then your tricuspid, and then your mitral. Okay, that wasn't so bad, was it? Okay, and now we're gonna go ahead. I'm gonna go ahead and have you turn to your left, well, to your side, and I'm gonna look at your veins on your neck. This is just to make sure you have no jugular vein distension. So this is looking for heart failure or fluid overload, and I'm palpating and it's not distended. So let's look on the other side. And there's no swelling or anything of that nature on this side. And now I'm going to use my stethoscope, the bell part of my stethoscope, to take a listen to you. Okay, and you have normal sounds. So some abnormal sounds you would be listening for is if there's absent sound, then there could possibly be a blockage. And if there's like a lot of sound, like it's like a swoosh sound, then that means that you could just have a high flow of turbulent blood in that artery. And so let me take a listen to your other side. Okay, and this is a normal sound as well. So if you have any of those normal sounds, or you have symptoms of heavy breathing, shortness of breath, or like a phlegm cough, and if I listen to like your heart and lungs, they probably have like a congestant sound to them, but they don't. So you are good, and your assessment went well, Miss Kitty. Okay, and Miss Kitty, if you don't need anything else, I'm going to be leaving you for today. Do you need anything else? Because I have your call bell right here next to you. And if you do need anything, just let me know, okay?